Hello friends, Dr. David Katz with another COVID reality check. Most of you, I suspect, want me to get right into it. Excuse me, and that's what I'll do. Anybody wondering where I've been these past months, I'll append an explanation about that at the end of this. Feel free to watch or ignore as you choose. What I want to talk about today is pandemic responses, responsibilities, and the roots of rebellion. Because this pandemic has incited something very closely related to rebellion in our society, pulling us apart at a time when our solidarity, our cohesion, and collective action could not be more important. They are absolutely essential to our pandemic response. This pandemic would have gone much better. Many fewer of us would have lost loved ones. The overall toll of this on lives and livelihoods would have been less if we had been capable of collective action, common cause on common ground. But frankly, more importantly, as far as I'm concerned, because pandemics end, and however bad this one ultimately is when history is done with the scorekeeping, it won't be as bad as the loss of democracy in America. And democracy in the United States of America is imperiled because of that same rebellion, that same inability to come together and perceive and react to the truth. And finally, the greatest threat of all, by far, an existential threat to our species, the ongoing degradations of the planet and climate, which absolutely requires collective action. So the aggravation of our antecedent polarization, the aggravation of rebellion, something listing in the general direction of civil unrest, if not war, tangled up with the roots of our pandemic response is a tragedy and a travesty. And I want to talk about where I think the cause resides, because perhaps it's not too late to do something about it. So you'll note that the title that I used at the start of this, which by the way will also be the title, that or something very much like it, of a written column that I will attach to this video, where I will elaborate, if not more, at least somewhat differently. The written word tends to be a little bit different. On the same topic, I'll include some relevant graphics, is about responses and responsibilities. And I trust you aren't waiting for me to point out the commonalities of those two words. The roots of response and responsibility are the same. But I would argue that despite being etymological siblings, those words have been disconnected egregiously during the pandemic. And I think the failure to link pandemic response to some clear articulation of responsibility and, frankly, respect for where responsibility ought to reside is the bedrock of our pandemic failure. And to be clear, I think we have bungled this pandemic from the start to the finish, whenever that will be. And I think it's the roots of our burgeoning rebellion. I think this is a tale of four phases, and let me quickly walk you through them. They could be parsed into more phases, and these phases could repeat because the phases of the pandemic itself are somewhat redundant. You get a new variant. We now are dealing with Omicron in particular as I record this, and the game changes and you need to update the rules. But let me take you through what I think are the four phases. And let me note that really the issue here is that at every step of the way, there should have been respect, clearly stated respect for the exercise of responsibility. And there should have been an equally clearly articulated effort to say where responsibility resides. And I have a long history, by the way, of respecting the importance of both personal responsibility and collective responsibility, public accountability. I do believe in government. I believe government does things that no other entity will do. No one else is going to build or pave the public roads. No one else is going to deploy the military. We need a government. We can then debate from extremely conservative Republican to extremely liberal Democrat across that spectrum exactly what should government do and for whom and when and how much. But we're already on common ground saying, okay, we know there's a critical role for government. So government, if it is to exist, and I believe it must, needs to have responsibilities and needs to have the boundaries of those responsibilities defined so that when it's government action that's required, I understand that. And when I'm empowered to take responsibility for myself, the government understands and respects that. And again, my hope here, folks, is that whatever your political inclinations, we can agree on that. There is a dividing line somewhere. We can debate where to draw the line. None of this was ever discussed during the pandemic. And that may have made sense for the first 2 or 3 weeks, but it never made sense after that. And I would argue it didn't make sense even during the first 2 or 3 weeks. So again, I think it's a tale of 4 phases. Let me map them out. So going way back to early 2020, late 2019 even, this virus, the original SARS-CoV-2 virus, emerged in Wuhan. We started hearing about that. It spread pretty quickly to Seoul, South Korea. We heard about that, and we had a lot of data. And at that time, there was a lot of debate about how big a threat this would pose in the United States. Although we had very clear evidence, I wrote about it at the time, in particular out of Seoul, where they tested 200,000 people in 48 hours, that SARS-CoV-2 never was a one-size-fits-all threat. It was a bad actor for old and sick people. It was a much milder infection for young, healthy people. But these were data from the far side of the world. I think it was reasonable to say, yeah, but we have a lot of chronic disease in the U.S. We have hyper-endemic obesity in the U.S. We really want to know who is at risk for what here. We want homegrown data. So this is phase 1 of the pandemic. Unknown risks, unknown responses. Where does responsibility reside then? It resides with the federal authorities who have to ascertain the risks and generate guidance for the responses. That's fine. This is the government's time to take charge. But frankly, they didn't. There was a lot of bloviating. But here's what should have happened immediately. As soon as it was clear there was a risk, as soon as it was clear the risk was significant, and as soon as it was clear we didn't know how great the risk was or to whom it pertained, a Camp David summit should have been convened. The federal government at that time should have called upon all of the best experts in virology, epidemiology, public health, pandemic response, emergency preparedness, surge capacity, managing hospital systems, and importantly, people with expertise in the conditions that seem to be conferring greater risk, namely chronic disease, my particular area of expertise. And there should have been a focus on social determinants of health. The first thing that should have emerged from the Camp David Summit is a clear statement from the federal government that our objective in this pandemic is blank. I think you all know, those of you who remember back those months to my prior videos, what my answer would be to fill in the blank. Total harm minimization. Any way the pandemic hurts people is bad. Any way we protect people is good. You know, frankly, if the pandemic causes a death because of viral infection, bad. If the pandemic causes a death because of economic devastation and suicide, bad. If the pandemic increases deaths from opioid addiction, bad. It's all different shades of bad. And preventing any of that is good. Total harm minimization. If anybody's got a rational alternative to total harm minimization, I'd listen to it. But I can't imagine there is anything that competes with it. The government's job then is to identify the magnitude of the risk best they can with early data, identify the distribution of that risk, and to start generating early guesstimates, if you will, of best protective responses. Responsibility resides with the government. We should have heard back then, we're going to hold this summit immediately. We call upon the nation to be patient for 2 to 3 weeks. We will exercise a national lockdown. We will deploy resources like the National Guard to help with supply chains during this time. We will distribute protective gear for people who need to be out and about during the national lockdown, but we anticipate this will last not more than 2 or 3 weeks, because that's the time we need to reach decisive conclusions about who needs to do what, when, where, and how to minimize total harms of the pandemic. Phase 1. And I think, frankly, all of us, whatever our political views, however much you don't like being told what to do, we would have complied if we'd been told this is going to last 2 or 3 weeks, because we are basically entering a war with this pathogen, and we're in a dense fog, and we need to figure out how to shine a light through that fog so we know where to go and what to do. It wouldn't have bothered me any. I would have been absolutely fine with that. This, of course, did not happen. And by the way, just a quick digression. I think both administrations here in the U.S. have badly bungled the pandemic. I would argue the former administration bungled it worse because, frankly, I don't think they cared about human lives. I think they just cared about looking good. And because they had a wholesale disregard for science, which is absolutely absurd and deplorable. So they bungled it extremely in one direction. However, sympathetic as I am to the current administration, which I think genuinely does care and absolutely is trying to do the right thing, I think they bungled it in the other direction. That they inherited a dumpster fire, but I think they've thrown fuel on it because maybe Newtonian physics took hold for every action, however misguided, an equal and opposite reaction, even if it's comparably misguided. And I think there's been excess hype, excess drama, a failure so far anyway to acknowledge that maybe the sky isn't falling on everybody, and we need to differentiate risk and allow for some personal responsibility. So I think we've just badly bungled this every step of the way. Okay, back to the main storyline here. So phase 1, unknown risk, unknown remedy, government responsibility. Phase 2, and I'm just going to look at notes because I want to make sure I say this the same way I'm going to say this in the written column. So phase 2 is at the end of that Camp David summit. We're just 2 or 3 weeks into this. This is early 2020. We have estimations of risk and provisional response guidance. And so at this point, since we have provisional guidance about things like masking, distancing, social isolation, other things we might do, the responsibility is still largely with the government. They need to help protect us. They need to clearly articulate these guidelines. In some instances, they clearly need to be mandates, such as the strict protections that nursing homes clearly required, and which we should have been able to figure out all the way back then. It was obvious. Remember the story in northern Italy of the extremely high mortality rate and how it was clustered in very old people? Remember that? It's ancient history now, right? We heard about Wuhan, then we heard about South Korea, then we heard about Italy. Before the pandemic rolled into New York, we knew that elderly people, and especially frail elderly people, the very people who populate nursing homes, were at extreme risk. So we needed extreme protections, which, by the way, I have written about since long before the Great Barrington Declaration, but which is the central premise of the Great Barrington Declaration. Focused protection does not mean let the pandemic rip. It means identify the people who are vulnerable to bad outcomes and do whatever is necessary to protect them. It means more protection, not less, but targeted to the people who most need it. So the government really should have been involved in the deployment of resources to build essentially pandemic firewalls around those settings that absolutely could not afford to be exposed to the virus, offering the rest of us very clear guidance about the best protections we could all use, and allowing for some degree of personal responsibility in the exercise of those defenses, if that made sense. But at that point, since there was no reliable means of any one of us defending ourselves from the virus, more government responsibility still made sense. So we're now talking, after the first 2 or 3 weeks in the Camp David summit, we're now talking about a span of maybe a few months, maybe longer, The government is obviously authorizing a rapid vaccine development campaign, a search for drugs. There should have been a clearinghouse on clinical advances. A lot of things. I can't get into all the details of coulda, shoulda, woulda, because again, from my point of view, we messed everything up. So that inventory is just too long. But obviously the work on vaccines should have begun as it did. Guidance about individual protection. But still, in this early phase of the pandemic, more government responsibility. There also, if you remember way back then, we just heard flatten the curve. There should have been more honesty. Mathematical modelers were already saying if all we do is flatten the curve, in other words, we basically hunker in bunkers and then eventually come out. If we haven't stayed in our bunkers long enough for the pandemic to be well and truly over, when we come out, it'll all kick right back up again. Hello, welcome to the experience we've all had these last couple of years. That's exactly what we've been living through. So there should have been more honesty that you can't just flatten the curve. There has to be a next step, phase 2. This is now phase 2 of my 4 phases. So government is providing us guidance. By the way, to be clear, the incubation period of SARS-CoV-2, all the different variants, is measurable in days. If we ever had really effectively locked down for long enough to exceed the incubation period and then kept everybody sick in relative isolation and then come out after, the virus would be gone from the population. If people get infected, recover, and people who haven't gotten infected stay relatively isolated longer than the incubation period, so if they were going to get sick, they would have done it already, you have stopped transmission. That would be hard to do in a population of 330 million people, essentially total isolation from one another. However, just something to think about for the next pandemic, you'd only need to do that for several weeks. And then nobody is infectious anymore. People who've gotten it and gotten sick are no longer infectious, even if they're still sick. People who haven't got it can no longer get it. Total national lockdown for 3 weeks, the pandemic essentially could have been over, at least here. Now, pandemics are global. Can you coordinate a response like that globally? Even harder. But just something to think about, that more severe government response actually might be advantageous because it might be intense but very brief. And then we get our lives back in weeks as opposed to years. It seems pretty appealing right about now. Again, it's probably a bridge too far. But in any event, phase 1, unknown risk, unknown remedy, government responsibility for sorting that out. Use the best experts. Do it in a fishbowl so we all know what's going on. Televise the panel discussions at the Camp David Summit. Show us that it's a who's who in public health. All the experts we would want to be there are there. And people not just concerned about virology, but people who also care about other elements that impact life. Including health economists who can talk about the toll of wiping out employment and destroying supply chains, because again, any way a life is lost counts, equally important. Phase 2. And we're still, by the time we get through phase 2, we're just a few months into this. So this is still relatively early in 2020. The next phase 3, is stratified risk assessment and clarified guidance. So at this point, we should have enough data. And again, the government should have been in the business of collating, analyzing data, and making that transparent to basically Department of Health clearinghouse, online access for everybody. In particular, though, collecting and organizing information from frontline clinicians, so we had all the best information in real time. And we avoided boondoggles like falling in love with drugs sequentially that did not work when they were tested. But now, with enough population data, we can say, okay, who is and who is not at high risk of bad COVID outcomes? And we can start to clarify the guidance for protections based on level of risk. I have put together and shared multiple times a very simple color-coded risk matrix for the pandemic, because it was very obvious early on that elderly people were at greater risk of bad outcomes than younger people, and that sick people were at greater risk of bad outcomes than healthy people. And that creates a 2x2 grid, age and health status, and produces tiers of risk. And there's a huge divide between young, healthy people and elderly, sick people. And then there's the in-between. Well, that's not too complicated for people to understand, right? You don't need a PhD in gerontology or pathophysiology to understand, okay, older is higher risk, sicker is higher risk. I get that. So, why couldn't the government provide guidance that told us, here's what you need to know about your own age and health, and here is the risk cell that places you in, and here are recommendations for self-defense predicated on your personal risk cell. Everything in modern life is personalized. The pandemic guidance, start to finish, has been one size fits all. Absurd. Frankly, an anachronism, a failure to adhere to the standards of our culture. We don't do anything that's one size fits all. We have gotten pandemic response guidance all along. One size fits all, everybody do the same thing. Frankly, and I'm going to kind of anticipate phase 4 here, frankly, even with regard to vaccines, because the advice to get vaccinated and to get boosted and then to get boosted again, I've never heard official guidance yet that said, but if you've had the infection and developed immunity to it, then a different set of recommendations for you. How could there not be? How could we ignore the fact that almost inevitably with viral infections, the greatest immunity is acquired after recovering from the native infection? Now, that may not be true now. Maybe the mRNA vaccines, in particular Moderna, confer even better protection than the native infection. But the native infection and the production of antibodies is certainly not irrelevant. And it was systematically ignored. And by the way, I am in that camp. I had COVID a year ago, January of 2021. I was tested for antibodies. I made them. I had IgG. I was immune. I did get vaccinated. Again, I'll talk more about that in the bit I append here at the end, because I thought it made sense. I thought essentially the vaccine for me was a booster. I still believe that was the right choice. But again, then the advice kept coming, get boosted. I think, well, for me, vaccine 1 already was a booster. I had native immunity. Vaccine 2 was get another booster. How many boosters? There was never even that level of differentiation. Those of you who've had and recovered from COVID, this set of guidelines. Those of you who've not had the infection so far as you know, this set of guidelines. Those of you who don't know, testing available to find out whether or not you have antibodies. Does this sound like rocket science? Even just those 3 tiers would have gone a long way to tell us you're not just being treated with heavy-handed disregard for who you are, what you're at risk for. So, again, I think risk stratification, absolutely crucial. Another quick digression, and those of you who've heard any of my prior videos know that this is a passion of mine. A massive part of that risk differential resides in America's prior pandemic, long-standing pandemic of obesity and chronic disease. Obesity is an extreme risk factor, in particular severe obesity, extreme risk factor for bad COVID outcomes, even in young people. Chronic disease, diabetes, hypertension, heart disease, all important risk factors for bad COVID outcomes, and all massively prevalent in the United States of America, where we systematically neglect health. Have you at any point heard a national call for addressing that? We're 2 years into this pandemic now. Do you know how much we could have done if we'd had a serious national, state, community, faith-based, employer-based effort to improve health? Let's fix all this hypertension. Let's work on eating better. And because we're in a crisis, let's actually do stuff it's hard to do when we're not in a crisis. Let's deploy mobile units with high quality food into food swamps and food deserts and help people actually access fresh produce and provide simple recipes and beans and lentils. And let's do cooking demonstrations on these mobile units and show people how to make healthy dishes. Let's take advantage of this opportunity, which is exploiting America's bad health to fix America's bad health. And oh, by the way, shift huge portions of the population from cells at high risk to cells at lower risk. We can't change chronological age, but we can significantly alter the state of our health. We can do a 180. You can go from having hypertension, insulin resistance, active inflammation in your body, coronary disease, to not. I'm a past president of the American College of Lifestyle Medicine. It's what we do. We know that we can not just prevent chronic diseases with lifestyle, we can treat them, we can reverse them. This should have been a national campaign. It's gotten almost zero attention. Complete abdication of responsibility to say, let's not just treat the effect, basically a massive toll of the pandemic. Let's treat the cause, a population that was exceedingly unhealthy to begin with. And by the way, independently of this pandemic, that should matter just as much, because that bad health is killing hundreds of thousands of us prematurely, our loved ones, every year. That's the pandemic that hides in plain sight. It was here before SARS-CoV-2. It will be here after, but it impacts the outcome of the SARS-CoV-2 pandemic. And we could have addressed it. Okay, phase 4. I'll go back and quickly recap these. So at this point, we have refined risk stratification done, not just by the government, but now all of the private scientists and epidemiologists around the world have been in on it. We have defenses that have been widely deployed. So if we need masks and test kits, the government's done its job and made those available to us. We needed vaccines developed in record time. The private sector, supported by the government, has done its job, and America's amazing access to scientific resources and frankly global collaboration produces those vaccines. They're now available, and they're made freely available to all Americans. This happened, of course. And then guidance is personalized, because now if you want to be vaccinated, you can be. And by the way, that's critical. If you're going to withdraw the heavy hand of government, you need to make sure that everybody does have the option of self-defense. Right? Essentially, the government is protecting us when we can't protect ourselves. When you are fully empowered to protect yourself, the government should hand over responsibility. And if we have effective vaccines available to everybody, accessible to everybody, and affordable to everybody because there's no charge, government can back away. So at this point, I think government responsibility is to make sure that those resources are available to everybody, to keep doing that job, to provide updated guidance, and then, frankly, to confer personal responsibility for making use of universally available resources. And I think this allocation of responsibility from public to personal, always shared, but shifting, more public in the beginning, more personal in the later stages, should have been clearly articulated. We should have known, what is the government's objective? Our job is to defend people who can't defend themselves. As we make resources available to empower you to defend yourself, and as we all gain a clear understanding of who's at risk for what, so you can make informed choices for yourself and your loved ones, we are going to pass the baton and turn over more responsibility to you. 4 phases. Phase 1, risks unknown, remedies unknown, responsibility overwhelmingly with the government. We need to do what we're told because we're all in peril we don't yet understand. Phase 2, early risk estimates and provisional response guidance available. Responsibility largely with the government to generate policies to protect us, but inviting us to act on those recommendations and minimizing mandates, but directing mandates to where they will do the most good. Again, one obvious example, mandated protections for all extended care facilities and nursing homes, obvious. Phase 3, stratified risk and clarified guidance, and now personalization of the responses that are recommended based on your risk tier. So the government is telling you, here's how you can know what risk tier you're in. By the way, I've talked about this before. I have colleagues who developed far more nuanced risk calculators for COVID than just my simple color-coded scheme. I'll attach a link. That opportunity was available. Everybody could have used an online tool, found out exactly what their level of risk is, and used that to access a menu of recommendations from leading experts. Here's how you can protect yourself. That's phase 3. Phase 4, vaccines are available. Government's job is to make resources available, continue to confer their protection on those who are most vulnerable, but shifting responsibility to those of us who now have resources and are called upon to use them. And I'm not saying this because I think, we shouldn't be using masks in appropriate circumstances or shouldn't be socially distancing. I think the rebellion against that was because there was no clear indication of how the government was willing to share responsibility. I think people, frankly, were offended, affronted, insulted. As I'm a mature, autonomous adult. Give me good information and good resources, and I'll protect my family. There was no respect shown for that, and so people who would have behaved well, if given the opportunity to exercise personal responsibility, started to behave badly because it activated their rebellious spirit. I think the roots of rebellion were the failure to honor the ineluctable bridge between response and responsibility, and a failure to articulate who's responsible for what when, and to show respect for personal responsibility along with public responsibility. This is my centrist view. And again, it's very consistent with how I viewed responsibility for food policy and so forth. I mean, yes, we need individuals ultimately to eat well. This is what my career is focused on, is the impact of diet on health. But the choices individuals make are subordinate to the choices populations have. It is the government's job to make sure we have good choices. And then, and only then, can we call upon individuals to make good use of good choices. The pandemic is very similar. And so there needed to be these 4 phases. I do not think any of this happened. I don't think there was any clarity at any point from the federal authorities about risk differentials, the importance of differentiating self-defense based on those risk differentials. And I think that's particularly acute and egregious now during Omicron, where we seem very focused on preventing spread when, frankly, it's no longer possible. 2 years into the pandemic, there's absolutely no tolerance for significant lockdowns. And this is the most infectious variant we've seen. So you're going to get exposed and you're going to get it, unless you are dealing with an extreme lockdown situation. Now, should that happen? Well, you could argue we might still think that way about nursing homes, but we now have vaccines, boosters, and effective treatments. So I would say no. We just need to make sure now the government's job is, yes, try to prevent spread to the most vulnerable, but make sure every highly vulnerable person is both vaccinated and boosted. And yes, I am an adamant vaccine proponent. Vaccines need not be perfect, not perfectly effective, and not perfectly safe to be massively better than dealing with the pathogen. And that's what those are your choices. You're not in a perfect world when you're in a pandemic. You don't get to choose a zero risk option. You get to choose the better option, and the better option is these highly effective vaccines. Not perfect protection, obviously, against Omicron, but very, very effective protection, and not perfectly safe. There are some side effects of the vaccines in at least some small number of individuals, but very safe. Much, much better than taking your chances with SARS-CoV-2. For much of the population, maybe not for everybody. Again, maybe young, healthy people who've made it this far and have not gotten sick. Maybe Omicron, because it's a milder variant, maybe the risk-benefit trade-off in a healthy 20-something is very different now. We should allow for that. We do not need to mandate vaccines or protections against getting something that may be very much like a cold. We don't do that for other cold viruses, and it may very well be that's the direction we're headed now, that these variants of SARS-CoV-2 are turning it into the next so-called common cold coronavirus. So, again, I think these selective protections should be deployed even now. And we are hearing, by the way, that we can't ignore this, that hospitals are overwhelmed. There are a couple of reasons for that. First, this time of year, hospitals always fill up to near capacity and sometimes exceed capacity. Winter months increase the transmission of lots of viruses, influenza among them, but also rhinoviruses, other coronaviruses, adenoviruses, and more. And generally, these cause hospitalization in people with extremely poor health to begin with. So if you have chronic lung disease, for example, you have COPD, and you get a viral infection, you wind up very sick. The virus is just the nudge. It is the proverbial one last straw on the back of the overburdened camel. And hospitals deal with that every year. It's worse, obviously, when there is a virus that is circulating to almost everybody all at once, and you get this massive surge. So we do have this issue of what can we do to flatten the curve now with Omicron. But that's all about protecting the highly vulnerable. I keep reading, but you have to read deep into stories to get at this, that yes, hospitals are filled up, and yes, they're filled up with COVID, but half the people admitted have COVID incidental. In other words, they test positive, but that's not what they're in the hospital for. They're sick with something else. That's in almost all the reporting about hospitals filling up, but it's not at the top. It's not in the headline. It's paragraph 27. You really have to dig deep to find that information. That's important. It basically means it's the poor state of health, once again, in our country, the huge burden of heart disease and lung disease that's precipitating hospitalization, and Omicron is contributing. Okay, so then we need to be directing protections to the population prone to get hospitalized anyway, and maybe we can withdraw the heavy hand that we're imposing on others. Now, pandemics are complicated because, obviously, if you're young and healthy and you get Omicron and then you get together with your elderly, chronically ill parents or grandparents and you transmit to them, then once again, they are back in that queue at high risk for being hospitalized. So we all have to be careful. We have to understand that. But that's as simple as conveying to the population the precautions you need to take when you are interacting with someone at high risk, which leads back to this idea of risk stratification and guidance from the federal authorities based on level of risk, which should have been shared with all of us and linked to self-defense, which is really what all this is about. The goal of all of this drama is to save lives, protect people. And if we had clarity on who's at risk for what and how to match the self-defense to the level of risk, I don't think there would have been rebellion. And I think I can probably wrap this up there. Lots more to say about, I think much better ways to have managed this whole pandemic, but that probably captures it. There's a famous expression we all know, the punishment should fit the crime. Now, I think the remedy should fit the risk too. And I think by ignoring the indelible link between pandemic responses and responsibilities for that protection, that self-defense, we have cultivated and propagated the dissent, the discord, and the rebellion that currently roils our pandemic response, threatens our democracy, and forestalls the critical action we need to be taking together to save our imperiled planet. So stay safe, stay well, and here's to phase 5, where all this gets fixed. Okay, so for those of you interested in knowing why haven't I been doing these reality check videos for a few months, here's that answer. And I provide this addendum in particular because I had an email from someone recently asking if I was self-censoring. And I'm absolutely not self-censoring. I have weathered my share of projectiles thrown at my head during the pandemic for opining, but I'm undaunted by that. I was raised with Edmund Burke echoing in my head, for evil to triumph in the world, it is enough for good people to do nothing. Doing nothing, saying nothing was never an option for me. And I will always speak my truth to whatever powers may be, and the consequences be damned. And so it's important to me to state that, because that is bedrock for me in terms of my life choices and career choices. So no, not self-censoring. However, along with my devotion to Edmund Burke, I'm also very partial to Gertrude Stein. A difference to be a difference must make a difference. And I didn't think more commentary on the pandemic could make a difference. I'm not sure it can now either. But certainly the time I took off, there was a surfeit of opinion, and it was very clear at that point that whatever opinion you wanted to find, you could go shopping for it. Excuse me. And that's what people were seemingly doing. And getting more and more dug in. I mean, essentially, when you can go shopping in echo chambers to find the opinion you already own, discover that somebody agrees with it and say, Eureka, I was right, we get more and more polarized. So, there, I suppose, is a centrist group inclined to listen to opinions from both sides and carefully judge them. But it just seemed to me that there was a lot of that good commentary out there too, sensible commentary from a number of people. I have a number of colleagues who come immediately to mind. I like the commentaries of Zubin Damania, known as Z-Dog, Vinay Prasad, Marty Makari, Monica Gandhi, Jay Bhattacharya, and others. So I think that, if you wanted to find good commentary, you could find it. And I know I'm leaving out people that you may follow, and apologies that this is just a short list. There are many others. But you could also find whatever extreme opinion you want to find, and here's why this is an attempt at government takeover, and we're not doing nearly enough to protect ourselves, and the sky is falling. So anyway, I didn't think I could make a difference, and so I stopped talking. I'm also a partisan of Mr. Ed. You should never speak unless you have something to say. So I waited till I felt I had something to say. A couple other things. First, this is not my day job. I'm a public health physician, preventive medicine specialist, but I run a company, and it's very demanding and takes all my time. And I run a nonprofit, also very demanding. Being involved in pandemic response is not something I do in any official capacity. So making the time to stay fully current and weigh in is difficult. And so that's part of it too. And then finally, and this is actually quite important, I had long COVID since my infection in January of 2021. I was getting better, and then those symptoms were very clearly exacerbated by my vaccines. Not so much by the first, I got Moderna, luck of the draw, but very much by the second. And then subsequently, I believe, my wife and I believe that in various interactions with our kids, we've probably been exposed to and perhaps infected by both Delta at one point and Omicron. Those of you who've heard me clearing my throat throughout this, I think this is the aftermath of, it's also extremely cold and dry here today in Connecticut, but partly the fact that I think I've had COVID 3 times. I suspect many of you are in a similar boat, but I've been exhausted for much of the past year. I've had to do my day job anyway, but I didn't have to do this too. So I gave myself a bit of a break. I was just really tired. Yeah, I'm getting better. It'll be fine. I have no question about long-term recovery here. Essentially, this is a chronic fatigue syndrome. That's what long COVID or PASC really is, expressing itself variously in different people, just as chronic fatigue tends to do. But if you take good care of yourself in the fullness of time, your immune system settles down and you get over it. So those are among the reasons why you haven't heard from me in a while. One last thing I want to say for anybody who's still tuned in. We're hearing a lot of crazy conspiracy theories about the pandemic, right? I mean, the vaccines are what Bill Gates attempting to inject microchips into us. So, it's absurd. Why should they bother? They can track absolutely everything we do all day long as is, right? I mean, haven't you noticed that the minute you visit a website, you've got ads for their product popping up on your screen, within a second? Haven't you noticed that? I mean, what do they need microchips for? It's just silly. So, all that's complete nonsense. And particularly, it's galling nonsense when there actually is a coup attempt underway in America. Our democracy absolutely is imperiled. And yeah, sure, the giant tech companies have too much power. But frankly, one of the national parties, which is pledged to uphold the ideals, principles, and constitution of this country, are systematically dismantling it and assaulting our right to vote and have a peaceful transfer of power and a representative democracy. The idea that the pandemic response is the threat to our civil liberty, while ignoring the actual threat to our civil liberty, makes me think, it's like there's a child learning algebra in a classroom, and the conspiracy theory is, they're being taught incantations to set my house on fire. Meanwhile, approaching your house is an arsonist with a blowtorch, and you ignore that. Come on. I mean, let's confront the obvious. So much of the pandemic dialogue is, it's just absurd nonsense. It started to feel like you can't cut through this stuff with a machete. And that was yet another reason why I didn't weigh in. So anyway, this addendum, what I said before about 4 phases, response, responsibility. Yes, our democracy is in peril, but it's not the pandemic response that is a willful assault on civil liberty. This failure, by the way, of the current administration to address shared responsibility between public officials and individuals, it's not an autocratic grab. I think their intentions are all good. I think it's just a whole lot of inertia in the wrong direction. It's basically failure to confront the nuance of all this. We didn't do it at the beginning, and that opportunity seems to have gone away. But I don't see any autocratic grab, frankly, in the pandemic response. I just see misguided efforts and lack of subtlety. But the gerrymandering of every voting district and the systematic dismantling of right to vote and a collective effort to install minority rule in the United States, that's an autocratic grab. That one hides in plain sight. Okay, I maybe wandered off topic, but anyway, these are among the reasons why I haven't weighed in before. I've weighed in again now. I will do so if and when I once again think I've got something to say that might actually make a difference.